joint replacements are for people who have degenerative joints. The cartilage wears down. You're rubbing bone on bone. Typically, it's very painful. So for those people who've failed other pain control strategies, we take them in. We do joint replacements. Hips and knees are by far the most common. Nationwide, there's hundreds of thousands done every year. It's growing each year. The crux of the surgery is not to remove a bunch of things and replace a bunch of things. It's really a resurfacing procedure where we want to shave and remove a minimal amount of bone and put in artificial bearing surfaces. So for a hip replacement, there's a socket and there's a ball. On the socket side, we want to kind of remount and make a nice concentric shell circle side and put a new socket there. On the ball side, we want to remove the old damaged ball and with a little stem that goes under the femur, create a new ball. And that new bearing surface relieves pain. It's usually an outpatient surgery. There's a lot of changes if you had a hip replacement 10 years ago compared to now. Probably the biggest change is medical things, blood loss, pain, how quickly you recover has significantly improved compared to when I was training 15 or 20 years ago. So for the majority of people, there's a go home the same day. It's what we call an extended recovery. You'll stay 4 to 5 hours after the surgery to get up with therapy, make sure your pain's controlled, watch vital signs, just make sure you're eating and drinking, and then typically go home.